Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release, ASTER specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTER specialty. All right, Dorsey, tell me what's going on with your shoulder. What happened?
I was working on a patient.
Okay.
And I was showing her demonstrating a shoulder extension on the Pilates reformer.
Okay.
And I felt it kind of slip pop, whatever you want to call it. And after that, I had pain. Just barely, like maybe a 3 out of a 10. And then we finished her treatment, and the next day I noticed I didn't quite have the range of motion, and I had more pain doing patients.
Okay, so what do you do, your career, your job?
Physical therapy.
Okay.
So when I'm manually working on people, I can feel it like right in here.
Okay. How long has it been going on?
About a month and a half.
A month and a half. And how much pain do you feel there at worst from 0 to 10? 10 is emergency room.
Usually about 5 or 6. As long as I don't take it to like the end range, and then it goes up.
And what aggravates your symptoms? What motion?
Working on people.
Like just pushing, pulling, or something?
Pulling. I've noticed a decrease as far as this like long arm flexion. Even bicep curls, I can't do what I used to do. I've been doing rotator cuff exercises and some scapular stabilization exercises, and can normally do them pretty good. I can feel myself substituting with those though.
Okay. How you describe your pain? Is it sharp, dull, aching? Where do you feel it exactly?
It's kind of sharp at the end range when I get there, and when I'm working on people pushing, it's just kind of more dull. But
is it more anterior, posterior? Where exactly the pain, or it's vary?
It's all of them. So I definitely feel it anterior. Sometimes I feel it inferior.
Oh, okay. All right. So let me see your range of motion now, and tell me how much pain at the end range.
Okay. Look up here, and that's probably like maybe a 3 right now.
Okay. All right.
If I repeat it, do repetitions, it'll get more.
Okay. Let's do abduction.
And that's gonna be about it.
How much?
That one really doesn't hurt that bad. It just kind of stops. Okay.
Let's do external rotation. I will have you stand up. Actually, we'll see a range of motion left and right. Back turn.
You want this one? This is my normal one.
Yeah. You're definitely going. Do both at the same time and see. We'll see the restriction. Yeah, that's very limited, and that's for a month. Yeah.
Yeah.
Okay.
That's working on it.
I'm gonna do your range of motion now for your shoulder. So let's have your head over there. Have you had any treatment for that?
Nope, just me treating it.
Okay. How do you do that by yourself? Like, it's not easy.
I get into a doorway, or I grab onto a counter and like move my body, so my shoulder's there, and I move my body on the shoulder.
And you said it's around this area? Okay, thank you. Okay, so flexion. So I want you to get the numbers here. Okay? Sorry.
So now it's already aggravated.
You can see this is more. How much from 0 to 10?
You know, just laying here, it was nothing before, and now it's probably like a 3 at least. So.
Okay, sorry. Okay, we're gonna do that quickly. So flexion. Okay. So you see that it's 155 here. Flexion 155. Okay. Let's do the abduction. Gonna be from the top. Oh wow. Let's try
it's easier standing up.
Yeah.
Oh. Yeah.
Is that abduction?
Yeah.
Sorry. Okay, so you can see it here.
It's just I can't raise the arm up.
It's like 95. Actually, it's 80. Look here. 85. That's 85. right in here, 85.
But like if that was supported,
Uh-huh.
I could do it. It's just like I can't hold it.
We're gonna use the same exact position to be
Okay.
accurate, you know, before and after, because you felt it jam here.
Yeah.
Okay, so external rotation backward. So external rotation is, okay, it's 70. It's not bad. 70 here. Okay, internal rotation. Down this way. Okay. Internal rotation like 58. It's about 58. Okay, sorry.
That's better.
You're really tight.
That's
Okay.
better.
But it was worse than that
Yeah.
before you worked on it?
Yeah.
Man.
I could barely get my
It's
my
not
hand
easy
behind
to
my
work on
back.
yourself.
No, it's not.
You have to be very creative, actually.
Well, because of the other one, remember the therapists that I have seen before you
Uh-huh.
have not been good.
Oh my goodness. Oh. So how? No. The problem was, actually, studies showed if you do excessive exercises for acute injury, that cause flare up. Okay. And one of the studies, they said actually the control group did better than physical therapy group.
Yeah.
Can you believe that? So
Well, it's because of
just
people
leave it
like,
alone.
that's like I have friends that like they go to lift weights, and it's a Saturday morning, 5:30 in the morning. They go straight to a military press, no warm up, nothing, full body, full weight, like
That's crazy.
200 pounds. I'm like,
They're gonna get injured.
They totally
This one-
did.
Yeah,
yeah.
that's crazy.
And now this one's still injured. He keeps wanting me to work on him. I'm like, no.
You feel the scar tissue here? It's a big lump here. Yeah. So you felt it snapped when that happened, or?
Yeah, it just kind of like it was almost like you know when you translate a little early, so
Okay.
it's never done that before, and I was pretty strong before that. Now I feel weak.
Well, it's you got a lot of big scar tissue in here. Okay. Is that too much? So,
No, I just felt it
You
like a
felt
lot. Yeah.
Yeah. Make sure it's not
Wow.
too much. But you feel the thickness of the scar tissue
Mhm.
here, the tightness even in your fascia. So I'm just gonna release it. And sorry, this is the pressure I'm doing actually.
So how do you feel the difference between the scar tissue and just like an inflamed muscle?
Well, if it's inflamed, it's going to be very sensitive.
Mhm.
I'm not going to work on it if it's
Okay.
inflamed. If it's a scar tissue, you're going to feel the fullness, you're going to feel that like a knot. If it's a fascia restrictions, you're going to feel band or
Yeah.
rope or something like that. And the superficial fascia.
I'm just asking because I feel it with my thumbs at work, but I don't know how to
Oh,
feel
my.
it with that thing yet. I'm learning.
I palpate with my hands.
Oh, okay.
And I use the instrument.
Okay.
With the other instrument, you can feel the scar tissue actually better than your hand.
Okay.
With the fascia,
Sweet.
with the fascia, you have to use, for the deep, you need to palpate with your hand.
Okay.
Yeah. Feel the less fullness, you know, the thickness of the knot is decreasing. That's what I'm looking for. Too much?
No.
Make sure it's not too much. Now I'm gonna give you a needle. Okay. Not really.
I'd be up off this table.
Yeah, we don't give needle in physical therapy. Okay. Some they give dry needle.
Yeah, no,
You
no,
know?
no, I don't.
Yeah.
I don't say to anybody for that.
The study is not really showing a lot coming out of dry needles. Yeah. Just taking a lot of hypes. Is that too much?
I don't know what too much is. It's
As long as
I
it's
feel
not
it,
painful, it's okay. If you feel pressure, that's fine. It's normal to feel pressure, but if you feel pain,
that one's painful.
I'm gonna take it easy if it's painful.
One spot, yep.
Have you injured your shoulder before that happened, or just?
I had surgery on this side.
What did you do?
I was working and we were doing a skateboarding championship, and I just I think overworked. I was by myself and just working, and
You feel the scar tissue here?
oh yeah.
That's what I feel with this instrument. I don't need to use my hand with this. just use it on it, and I can feel the bump. And you see it's
That is so cool. I cannot wait to
jumping.
learn.
Yeah, you see that? And patient actually feel it, and you can see redness where you have more scar tissue, and everything like normal color. That's make it easy to find the scar tissue actually and work on it.
Well, so this one I ended up.
You
I
torn your rotator cuff?
I tore it. They thought I only tore the supraspinatus, and they had an MRI and stuff. And then I said, "Well, fix it. We're slow at work." And so the guy, there's a doctor nearby here too.
Do you feel the grinding here?
Yeah.
The scar tissue, and look at the redness. See the redness here.
It's the bruise where I was working on it earlier.
You see the movement of
the bruise where I was working on it earlier myself.
You worked by yourself here?
I do.
When did you do that?
About 2 days ago.
Oh man. You bruise yourself?
Yeah.
You use your,
I want the pain gone. So yeah, I would just, and it worked for,
Yeah, but you bruise it, you cause more inflammation. That's gonna cause more scar tissue.
I didn't know I was gonna bruise. I just did it my normal way. Now
so you use your
I'm on more vitamin C now.
Oh man. Okay, and you can see all the scar tissue. Alright, so can you get a towel please? Here you go. I have a towel here. Okay. So the abduction was a problem here. Excuse me. Podiameter. Did I put some? Here you go. You hiding?
Yeah.
Behind your head?
I didn't want you to do it again. No, I'm just kidding.
Alright, so let's do the abduction because that's the one we had a lot of issue with it. And tell me how far you can go. Where do you feel the tightness? This is tight.
It's like, this is why I'm like concerned, like if I've torn anything or not, but it's just sore right there. It just feels like my long head of my bicep or something.
Relax. Well, if you strain something, we're not going to be able to get more.
I mean, because it's just so weak. I'm not used to it being weak.
You feel it this way? Okay. Have you had any head trauma, falls, any accidents in your head?
Like when? Anytime?
Ever?
Oh, I'm sure. I don't know.
Concussion or anything like that? Or sutures or anything?
No, I actually got hit in the head with a baseball bat one time and I did it right here. I still got the knot right here.
Is it okay to work on it?
But that was back when I was like 10.
That's okay. Is it okay to work on? This is what you're talking about?
Yeah, but it doesn't cause any problem at all.
You have a scar tissue here.
Yeah, I know. I didn't even have a concussion. It just caused scar tissue there.
Do you feel comfortable to work on it or no?
I think
Okay.
Don't create a headache.
Me? No, we'll work. You said you have headache. You get headaches.
I get headaches always on this side. My migraines are always on my right side.
Okay.
Always. I don't have headaches
on
that side at all. I had it early this morning and I drank caffeine and it went away.
Oh man. Yeah, when you have headache, we want to work on it. Okay. Try to calm if you have the symptom because that will help to know where it's coming from.
Yeah, normally it's like right behind my right eyeball.
It's always on that side. That side.
Okay.
And knocks it there. Yeah.
Ooh, that feels good.
But you made faces.
I know. I'm surprised how tight it is.
Okay. So.
This is gonna work my little clavicle, huh?
You know, I'm doing fascia release now. The clavicle fascia release. And I'm gonna actually get there. Make sure it's not too much, okay? There you go. This is good. Feel this one here. Let me get here. This one.
That could have a bearing on that little shoulder joint.
Yes. Because you need your clavicle to rotate. You know? If your clavicle fascia is tight, you're not gonna have joint mobility here. I don't use joint mobilization because the joint. What causes the joint to be restricted?
Soft tissue.
Why we do the joint mobilization?
Right.
Excuse me. It's basically working on the symptoms instead of the source of the problem.
I do joint mobilizations. Always ones or twos. I don't go anything before that.
Even the study, there is at least 6 to 7 systematic reviews that shows joint mobilization does not have. Some of them it shows short term, others does not show anything.
I should say spinal.
Effects.
I just do spinals.
Yeah. It's hard in your hand too.
It is.
Yeah. That's why I don't use it. Okay. Let's do the abduction. See how that feels.
Oh, dude. That is so
Look
awesome.
at that. Look at that.
Oh
how much
God.
was the abduction before?
Oh my God.
85?
That is so freaking awesome.
Okay, look here. It's 165. Okay, 165. Let's try again. That I need to do one more thing.
Yeah, bring it back for me.
If we can bring it back all the way. Did I do any joint mobilization?
No.
Any stretches?
No. I can't wait. I'm going to work tomorrow. Look at me. You guys are in trouble.
You have more strength now. Like
Originally how I hurt like my back part was I had 4 big patients over like 275 or so.
Don't do stretches.
No, I wasn't. I was just working on them. But by the 3rd one I'm like, oh shoot, I don't schedule.
I used to do that. I get my reps out of alignment because I used to stretch a lot of hamstring patient. And because I was tired, I put in my shoulder. Man, that was a bad lesson to learn, not to stretch. Okay, let's do it again. So originally was how much? 85. Now we are 173. Good, 173, not bad. Okay, what about that?
And I can bring it back myself.
Yeah, and flexion, how much it was?
155. 155.
155. Let's do the flexion. Okay, flexion is 175. So it's increased 20 degrees. Okay. The abduction was 85 and increased like almost double. Not good enough. Okay. So external rotation, how much?
70.
Okay. Are you trying to show off now? Sorry.
Yeah.
Yeah, it's 85, okay? Oh, sorry. It's 90. It was 70, 90, okay. So internal rotation, how much it was?
58.
58? You said 58, yeah?
Yep.
Oh, okay. That's a 75. Alright, zero for me.
Nice.
So move it around. Let's get a full belly. And tell me how that feels. Up.
That's good.
Any
It's
pain,
not-
discomfort?
A little bit still. I can feel it kind of like right.
How much from
In
0
here.
to 10?
Like compared to what it was before, like I don't know, 1, 2.
Okay.
I can kind of feel it kind of crunching. Kind of.
Okay,
The joint
let's
just
turn
feels
around and we'll see.
used to-
One is
Makes
fine,
sense.
okay? Let's do like face the window and let's bring your arm back.
This way.
Yeah, both of them because that
Oh,
was
this way?
restricted. Yeah. How's that? Look at that. Look at do that. Look at that.
Little tight at the end range, but that is.
But you actually
Phenomenal.
you're able to bring it back all the
I
way.
know.
Yeah, let's turn around. How that feel?
It feels great.
All right. What do you think about the ASTER treatment?
I think I'm coming back.
All right. Awesome. Thank you so much. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTER certified, you can follow the link below. You will get information on how to register for ASTER online class. There's over 40 studies that support ASTER treatment model, and also there is over 400 studies that utilized by ASTER treatment, and feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.